Ultimately, medicine is about treating patients, healing patients in the real world. So the starting point is the real world. So the ultimate focus needs to be the real world. And it's quite clear that, and uncontroversial, that trials of efficacy, randomized controlled trials that address efficacy, are relatively, have a very low, what you call external validity, so a relatively low applicability in the real world. That doesn't mean that you can still do sometimes rigorous designs involving randomizations, but you want to do more, in that case, randomized controlled trials addressing effectiveness. And there's various studies. Claudia Witt has done important studies, but also a very important series of studies has been done in France. It's called the AP3 series. It was conducted completely independently by universities with leading epidemiologists in France, and they looked at practice patterns. They focused on psychological conditions, rheumatological conditions, and also respiratory tract infections. And they looked at practice behavior of physicians. And there was a very convincing evidence that physicians that worked in the real world with homeopathy, they got equal results and very often with less side effects. And these were very large samples that were obtained in France, and the data was very valid because they were able to obtain data from the French Social Security. So because homeopathy was covered partly by the Social Security system in France, so the data that was obtained was very hard and reliable data. And so independent experts concluded very positively about the real-world effectiveness of homeopathy in these very common conditions. The studies in France, they looked at 3 different types of practices. They looked at practices that used only conventional medicine, and they used practices that used mixed, and they used practices that used only homeopathy. The practices that worked exclusively with homeopathic treatment for those conditions, they were in general deemed to be equally effective as conventional management, and in some cases better, and also in some cases what they demonstrated relatively that there were less antibiotics used, for instance in upper respiratory tract infections, where they looked. So they found equal effectiveness, sometimes less use of conventional medicines, and sometimes even better effectiveness of the homeopathic practices in terms of their outcomes.